I'm Dr. Stephen Davidson, the sexual integrity coach located in Wilton Manors, Florida. Welcome to another episode of Adult Sex Education. If you've been watching for a while, you know that I often cover topics requested by subscribers. However, I also get random questions that warrant a reply but are either not general enough for a 15-minute video, or the question isn't specific enough for me to really know what the viewer is asking. Today I'm combining several questions from different viewers that are related to the same topic, and it's all about butt stuff. In case you don't watch the disclaimer at the end of each video, let me emphasize that my videos are for education purposes and are not intended to diagnose or treat any mental, medical, or sexual disorder. While I am a licensed mental health provider and certified clinical sexologist, unless you have an open file with me, I'm not your personal therapist or coach. So use this information for your own education, but also seek the services of a healthcare provider when you have concerns about your own specific healthcare needs. The first question comes from Jay, who asked if there's an age limit for rimming. The age at which one starts or stops rimming is a personal choice. I will remind you that rimming is a sexual practice, and laws pertaining to age of consent will apply here as in all other sexual activities. So as long as you and your partner are both old enough to legally consent, I see no reason why you can't enjoy rimming well into your senior years. Jeffrey messaged me and he wants to know if anal douching is safe. Generally, yes. Most pharmacies sell rectal syringes for anal douching as well as ready-to-go enemas. So follow the instructions on the box or ask the pharmacist or your personal physician if you have concerns that are specific to your healthcare circumstances. Gary asked if women enjoy anal penetration as much as gay men. Well, the answer to that generally is no. It is also important to acknowledge that there are many gay men who don't enjoy anal penetration either. Men who do enjoy being anally penetrated, both gay and straight, like the stimulation of their prostate, which sits on the other side of the rectum. Since women don't have a prostate, they don't experience the pleasurable sensation men do during anal penetration. When women agree to anal sex, they are mostly doing it for his benefit. When women self-pleasure with a finger or toy, they are generally not sticking it in their butt because they get little or no pleasurable sensation from this. Many men, however, find that their orgasms are more intense when they are experiencing stimulation to both the penis and their prostate at the same time. This can be achieved with just one finger, but there are also toys designed specifically for men and contoured to get right to that special spot. Of course, some men prefer penetration by their partner's penis because it is more intimate and pleasurable for both. It's also worth noting that there are those men who are able to achieve orgasm entirely from prostate stimulation without ever touching their penis. Carlos wants to know if I recommend that men get an anal pap smear. Carlos, I think that's a great question for you to ask your primary care physician. An anal pap smear is a screening test for anal cancer that can result from HPV, a virus that is sexually transmitted. You will likely have to initiate this discussion with your physician because these are not standard screenings for men in general. Physicians who specialize in gay men's health often recommend a pap smear, but you need to make that decision with the guidance of your personal physician. Personally, I am pro-prevention and early detection. I always choose healthcare providers for myself who will listen to me and take my healthcare seriously. So I'm not shy about requesting any test or vaccine that I think will help me stay healthy. Marie says that she sometimes has spasms in her rectum that feel like they spread into her groin as well. She says no one else she knows has ever experienced this, and she wonders if she should see a doctor. Anytime you ask the question, should I see a doctor, the answer is likely yes, you should. Both men and women have a pelvic floor that consists of tiny muscles that help us do things like sit, walk, stand, and balance. These muscles can spasm just like muscles in your neck, shoulders, and back. We can carry tension in these muscles the same way we carry tension in other parts of our body. Some physical therapists specialize in treating pelvic floor pain, and Marie, that is exactly what this sounds like. Start by talking to your primary care physician or gynecologist and go from there. Anthony asked me if rimming is safe. Anthony, nothing is safe. Everything comes with some degree of risk. Everywhere in life we do dangerous things knowing that there is some degree of risk involved. It's why we wear seat belts and wash our hands. So if you enjoy rimming, then learn ways to minimize the risk. Hepatitis A, HPV, and several other diseases can be transmitted during rimming. Being clean and using dental dams or even handy wrap are ways to minimize risk. Anytime we engage in any sexual activity with another person, we are at risk of contracting an infection. This is a great opportunity for me to remind you that we humans are nasty creatures and we infect each other in lots of ways that have nothing to do with sex. Anytime we're in close proximity with another person, on a cruise ship, an airplane, a theater, or even at work or school, we're coming in contact with the viruses and bacteria they carry. However, we feel more shame about diseases we contract sexually because we've been socialized to judge those diseases more harshly. Do what you can to prevent a sexually transmitted infection, and if you get one, do what you can to treat it or manage it. But if you're going to be in a sexual relationship with one or more people, there will always be associated risk. You certainly reduce the risk of having an STI by having fewer partners. But it only takes one infected partner to contract an STI. You don't get a sexually transmitted infection simply because you've had sex with a lot of different people. We usually don't shame people for catching a cold or the flu, so remember that if you're inclined to shame someone who has contracted a sexually transmitted infection. If you're into butt stuff or you have more questions about butt play, I want to recommend this book, Anal Pleasure and Health by Jack Morin, a guide for men, women, and couples. It's a great book with lots of useful information about anal pleasure and anal health. Of course, I also recommend my own books, Sexual Integrity, Finding the Courage to Be Yourself, as well as Peaceful Mind, Peaceful Life, the Guidebook to Happiness. My books are available on Amazon, Audible, Kindle, and fine bookstores everywhere. You can get a link to my books as well as learn more about my sexual integrity coaching on my website at sexualintegritycoach.com.